Welcome back to my YouTube channel. This is Livina Oduji, and I will be your instructor for today's lecture. Today we're going to talk about CNA question and answer. Actually, this is part of the test taking skills. We talked about how to select the correct answers, and we're going to use some of the questions on this video to practice our test taking skills. Question number 1. Which of the following actions will best prevent the resident from developing pressure ulcers? 1. Put hand rolls in the resident's hands. Avoid raising the head of the resident's bed. Turn and position the resident according to schedule. And provide range of motion exercise every 2 hours. If you look on that questions, I have best in red color. So this is one thing you have to look for in your questions. In the previous test taking skills 1 and 2, I made mention of priority questions that you need to look for the options. What you need to look for in your question. If it has something like best, most, appropriate, most or least appropriate, have in mind that the whole options might be correct. Now you are expected to select the best among those options. In these options here, we have A. Put hand rolls in the resident's hands. What do we putting hand rolls on the resident's hands? Will it prevent pressure ulcer? You need to ask yourself questions. Well, let's leave that option for now. Avoid raising the head of the resident's bed. What has this one got to do with preventing pressure ulcer? C. Turn and position the resident according to schedule. Let's leave that option also. Provide range of motion exercise. I know A, C, and D that people might be thinking about these 3 options. Which one now is the best? Now, A, the hand roll in the resident's hands. Ask yourself a question. In the first place, pressure ulcers, I know it can happen in any pressure points in our body. But the main place this happens is on our bottom, on the sacrum area, heels. And then you know that we're supposed to reposition our resident at least every 2 hours. Why do we have that? Because we don't want them to develop pressure ulcer. The hand rolls will help that resident prevent them from having contraction on their hands. Now, range of motion exercise. Is it going to help prevent pressure ulcer? Probably yes. Because when we're doing range of motion exercise, it's helping the muscles and flexibility and helping the muscles, right? Probably helping with blood circulation. But even if we have to do range of motion exercise, is it going to be every 2 hours? That is another question you need to ask. And again, the range of motion exercise mainly help the resident to prevent muscle atrophy and contraction. So the answer is C. That is the best option. Question number 2. Which of the following should be reported to the nurse or the charge nurse immediately? Again, you can see the immediately with the in a red ink. The whole options here might be correct, but we want to make sure, are we gonna report all of them immediately to the nurse? If you are in a dining room and your patient didn't eat very well or say that she's not eating, do you want to leave everything you're doing in the dining room to go and report to the nurse immediately that Ms. Jones says she's not gonna eat or she's not eating well? Probably you will finish the dining room duty and then report to the nurse. Yes, we have to report this to the nurse, but it's not just immediately. Let's leave B for now and go to C. A resident who refuses to take a scheduled top bath. I know this one, most of us, the CNAs, we will not even mention it to the nurse so that the nurse will not ask us to go back and ask her if she, ask her again. Because we'll be happy that our patient even didn't want to take a bath or shower. Most of us will not go to the nurse, probably at the end of the shift. Yes, we have to report to the nurse, okay? But is this something you want to do right away? Is this something you want to leave everything you are doing to go report to the nurse? Probably not. A resident who wonders is found napping in another resident's bed. Yes, this one we have to report to the nurse. But is there any danger in this particular one? What makes it immediately? Maybe we've been looking for this patient for the past 4 hours. I know there is a, element of urgency in this particular one, but considering B and D, which one will you report to the nurse immediately? If you are faced with these two options and you have to choose one that you need to report to the nurse immediately, safety is involved in this particular thing. It will be option number B. D, we might report to the nurse immediately, but there is no safety compromise in this one. The person is napping, sleeping soundly. We're all happy that the woman or the man is in the building. Yes, so the answer is what? B. Question number 3. A nurse aide walks into a resident room and finds a resident on the floor. The resident says, "I fell down and I cannot move my arm." What should be the nurse aide next action? Remember, this person says she fell down. But the critical point here is I cannot move my arm. Then the question is, what will you do next? These options here, you might be able to do the whole of them. Everything in the options, you might do all of them. But which one are you going to do next? The next action. That is what the question is saying. Now, the first option said, help the resident to a sitting position on the floor. You know that you don't have to get anybody on the floor. You don't want to touch that person or move that person because you don't know whether this person has fracture or not. Remember, the person say, I cannot move my arm, meaning something is wrong. It's either that the person is has too much pain, or maybe there is broken bone or dislocation. So you don't want to move that person. Now, ask the resident to stay still while the nurse aide calls for help. Let's keep that one for now. Ask the resident to describe the pain and how the fall happened. Yes, even if the person tell you describe the pain is 10 out of 10 and I was trying to get up and I fell. Is that what you should be asking somebody who said, I cannot move my arm? You just stand there asking this person. Now, after getting all this information, what will you do for that patient at that moment? D. Support the injured arm by placing a pillow under the arm and shoulder. Do you want to support the arm that you're not sure of, how bad the injury is? Are you the nurse who's supposed to know how bad or whether that arm is just pain or whether the person have fracture on it? allow the nurse to do their job. They have to assess this person to know the extent of the injury and then take direction from the nurse. So the answer is B. You want that person to stay still while you call the nurse. After the nurse assessment, then you will take direction from the nurse, either to put the pillow under the arm or get the person up, whatever the nurse tells you. So the answer is B. A resident hands shake while trying to drink liquids, causing the liquids to spill. What is the best response by the nurse aide? Again, best response. Remember, the whole options might be correct. You are required to choose the best option. Now, the person's hands is shaking. The liquid spilled. Now it's asking you what will be a response. Thicken the liquid so it will not spill. Who are you to thicken the liquid of somebody? Do you know that for you to thicken anybody's liquid, it has to be ordered by the doctor according to speech therapist's recommendation. So it's not your duty to do that. Place a clothing protector on the resident. Placing a clothing protector on the resident, you are trying to prevent that liquid or maybe the hot liquid to get to the patient's clothing, but it will not prevent that liquid from spilling. Seat the resident with other residents who also spill. This is competition there. So what would this sitting them together so that the whole table will be, all will be full of water? That's what it is. Or so that I don't know why you should sit all of them together. That would be causing more problem. Now, for this person that has the hand is shaking, we can't stop giving her water to drink. The best thing we can do is to get a cup that has what? A lid. So that even if that hand shake, it will not spill. D is the best option. A resident is NPO because of nausea. What should the nurse aide do? I hope everybody know what NPO is. Give the resident fluid in small amounts. Provide the resident with a small cup of ice chips. Ask if the resident can handle any fluids with the nausea. Remove any fluids at the bedside, including the water pitcher. Let's go to the next slide before we explain. NPO is a Latin word, nis per os, meaning nothing by mouth. If anybody is on nothing by mouth, meaning no food, no drink, even medication, by mouth. So let's go back and answer that question. So if this person has NPO order, that means there will be no water pitcher in that room. Nothing by mouth, no water in that room. Because you don't want this person to be tempted to drink water. Nothing by mouth. So the answer is D. A resident wears a hand splint. Which observation should the nurse aide report to the nurse immediately? Again, immediately. Most of these options, you might report them to the nurse. There are things that you have to report immediately. There are things you might wait to report. Maybe you are busy. You say, okay, let me finish before I report to the nurse. But there are things you cannot wait. I have this picture of hand splint so that you will understand exactly what we're talking about here. So when you have hand splint, this can cut circulation depending on how tight this hand splint is. So A is the resident fingers are cold and blue in color. Let's keep this option for now. The splint was removed as scheduled in the care plan. So why are you going to report to the nurse if the splints were removed according to the care plan? The resident has to have the splint removed for a few minutes. If resident said, please, could you remove this for a few minutes? There is reason this person is telling you this. Maybe it's too tight, it's hurting, or she wants to straighten that fingers on arm or hand, right? You will report to the nurse. But is this something immediately? Let's keep that option too. The resident asks the nurse aide to reposition the arm with the splint. If the person cannot reposition the arm, probably she will ask you for assistance, which is okay. Now, we have number A and C to choose one from any of these. The resident has to have the splint removed for a few minutes and the fingers are cold and blue. Which one do you think you have to report immediately? C might be that this is so uncomfortable for this patient. We have to report to the nurse. But when the fingers are cold and blue, meaning there is circulation problem. Probably that splint is too tight, and because of that, the blood flow is compromised, and that is why those fingers are turning blue and cold. That A needs to be reported immediately. C has to be reported also. But between A and C, A is the one that you have to report right away, followed by C. So the answer is A. Which statement is true about the effect of aging? The aging process can be reversed with good health care. Bladder incontinence is a normal part of aging. Joint tends to be less flexible as a person's age. Sensitivity to pain increases with age. Which one is the correct answer? Well, A says aging process can be reversed. If this is true, that means many people will be ageless. And if it's true, I need to find out how so that I will get it too. Bladder incontinence is a normal part of aging. Because somebody is old doesn't mean the person will be incontinent. So this is false. Joint tends to be less flexible as we age. True. Sensitivity to pain decreases with age. It doesn't increase with age. So the answer is C. The joints tend to be less flexible as a person age. Question number 8. A nurse aide enters a room to help the resident to the bathroom. A trash can in the room is on fire. What should the nurse aide do first? Remember what I said about these priority questions. This one say, what will you do first? Use the resident pitcher of water to put out the fire. I know most of us, majority of us will do this one. Open the window to get the smoke out of the room. This is the worst one. Yell fire along with the room number. Remove the resident from the room. If you will not be able to answer these questions, please use the acronym RACE. RACE. Now, the first thing you have to do when you notice that there is fire in the room or in the building, remove your resident first. That is the correct answer. Remove your resident. Remember this acronym for fire response, RACE, meaning remove your resident, activate the emergency, which is calling 911, confine, meaning closing all the doors, and then extinguish. So opening the windows will cause more problem. will make the fire to spread more quickly. So the answer is D. Remove your resident from the room. Question number 9. Many elderly residents lose their appetite due to what? Decrease in saliva, hardening of the arteries, decreased number of taste buds, both A and C. As we get old, the saliva production decreases. There is a decreased number of taste buds. This appetite don't have anything to do with the arteries. And because the saliva in the saliva production is reduced, it makes it hard for the elderly to even chew, hard things like crackers. And because there is decreased number of taste buds, it makes it hard for them to even when the food is tasting better or you have a lot of salt in it or a lot of sugar in it, they still feel that nothing is not tasty. There is no salt or there is no sugar. And if they are not tasting that food, if it's not tasting good or tasting right, they might not be able to have that appetite to eat. So the answer is D, both C, A and C. When a resident has left-sided weakness, what part of a sweater is put on first? Again, first. When somebody has weakness, from this question is a left-sided weakness, what part of the sweater will you put first? You need to understand this question. Some people might start thinking when they are doing dressing, you remember you have to remove the clothes that the person is wearing before you put the new one. But here it says, where will you start to put the clothes on? So we'll start from where? The left side. Left side. Because that side is weak, when you start to put this sweater from the left side, you'll be able to handle that arm that is weak very well and slide the sleeve in. Then the other side that is okay, or the strong side, the person can help by either raise the hand up or put it down to help you put the other hand in the sleeve. So we'll start from the weak side, which is the left sleeve, and the answer is B. It is appropriate for a nurse aide to share the information regarding a resident or client status with anyone the nurse aide seems fit, the client's family members, the client's roommate, or the staff on the next shift. I don't know why anybody should choose A anyway, but if you do that, remember HIPAA. The client's family members. Even if you are very good, in good terms relationship with the family member, don't give any information. And the roommate shouldn't even know what is going on with the other patient. Because they are in the same room doesn't mean they have to know everybody's medical issues. The only person you have to share information with is the staff that is coming on the next shift, or the one that is leaving on the next shift, or the other team members that need that information to care for that resident. It's not anybody you see in that facility. It's not the family members. Let the family members go to the nurse if they need any information, not from you. So the answer is what? D. The staff on the next shift. Maybe the nurse aide that is coming to take over shift from you, or even on the ones you are going to take over from. That's the person you need to give information, not any of those people or any of those options. When helping a client who is recovering from a stroke to walk, the nurse aide should assist. This person has stroke and have maybe one side weakness and the other side is strong. Where will you stand when you help the person to ambulate or helping that person to walk? Remember, this person can do a lot with the strong side, but on the weak side he cannot do much. So that's where you need to stand to help that person while the person is doing or walking or doing whatever he or she wants to do with the stronger side. So when you're walking this person, you need to stand slightly behind the person on the weak side. So the answer is client's weak side. You don't want to assist from behind or assist with a wheelchair. This person, why do you want to assist with a wheelchair? And when the question is telling you is recovering from a stroke to walk, meaning the person is walking, why do you want to choose with a wheelchair in the first place? The answer is what? On the weak side. To best communicate with a client who is totally deaf, remember this said best and totally deaf. So this person cannot hear you. So to communicate with this person, what will you do? Smile frequently and speak loudly. Smile. She can see you smile. When you speak loudly, she cannot hear you. So why are you speaking loud? Smile often and talk rapidly. Even if the person can hear, why talking rapidly? Even speaking loudly too is not appropriate. Avoid eye contact. This is the worst one because most people that are deaf can read your lips when you are talking. Why won't you face them when you are talking? The best option here is D. They cannot hear properly, but they can see and they can read. So write out information. Which of the following stages of dying is the final stage? Final stage of dying. The answer is acceptance. Remember Elizabeth Kubler-Ross theory of stages of dying. The answer is acceptance. That is the final stage. So you can see here the 5 stages of grief is denial, anger, bargaining, depression, and what? Acceptance. Question number 15. Which of the following is the correct measurement of urinary output? Remember when you are doing your skills, you have that graduate, the container. If you look at that container, it has ounces and cc. And even on the recording sheet, it tells you that the urine has to be in cc. All right, so you have to measure urine output in cc. Let's take a picture of this. This is it. Oh, I'm sorry. So if you on this graduate, you will see one side is ounces, one side is cc. And again, for your skill, you have to pay attention because if you write the number on the ounces side, it will not be the same answer because that paper that you have that you're going to document is already on cc. So if you put any number from the ounces, it will not be the same thing as cc. So the urine output is measured in what? cc. So the answer to this question will be B. Question number 16. To convert 4 ounces of juice to millimeters, the nurse aide should multiply by what? Remember, 1 ml is equal to 1 cc. So if you have 30 ml, it's the same thing as 30 cc. So if you have any question like the previous one you just finished right now, the urine output can be in cc or it can be in ml, the same. And 1 ml is equal to what? 1 cc. But if you are converting ounces to cc, you need to multiply by what? 30. So 1 ounce is equal to 30 cc. That's why when you are recording on that measurement paper that you're going to use during your scale, if you write 1 ounces instead of 1 cc, you see it's not the same, because 1 ounce equals 30 cc. So in this question, the answer is D. We have 4 ounces. You multiply by what? 30 ml. I hope you get this. A client wakes up during the night and asks for something to eat. The nurse aide should check client's diet before offering nourishment. Tell the client nothing is available at night. Explain that breakfast is going to be ready in 3 hours, or tell the client that eating is not allowed during the night. This is okay. Now, what are we talking about here? If somebody wakes up and wants to eat, you gotta give that person something to eat. I know of everywhere, nursing homes, hospitals, they have nourishment room where they have all kinds of snacks and nourishment, and all those stuff. But you can't just give resident anything because the person said that she's hungry. You want to make sure you are giving that patient something to eat based on the what? Diet. If somebody is puree, or if somebody is mechanical soft, and you give that person something regular food, it can cause trouble. So you want to make sure, even the nourishment, even if it's ensure, you want to make sure that that person can take the one you are giving her. All this nourishment that ensure, there are ones for diabetic patient and there are some for regular people. So you want to make sure you know the person's diet before you give him or her any nourishment. After patient discharge, clean bed linens placed in a cleansed room but not used should be returned to the linen closet, used for a client in the next room, taken to the nurse in charge, put in the dirty linen. Of course, the answer is D. Remember that everything in the resident room is considered dirty. You don't want to use things for one resident and use it for another resident. Even if that linen in the resident room is clean, it's not used at all, it has to go into dirty linen. They have to wash it again before somebody else can use it. And that's why in a facility, they don't want you to take linens, take supplies and pack them inside resident room, because if for any reason the resident didn't use it, it has to go through laundry again. That would be too much. So any unused linen in a patient room has to go into a dirty linen container if that person is discharged. So, gather supplies that you need at a time. You don't want to create all these too much linens in a patient room. The nurse aide finds a conscious client lying on the bathroom floor. The first thing the nurse aide should do is, this is like the previous questions that we answered that said, I fell and I cannot move my arm. Yes, this person is conscious. The other person is too. So, and the first thing you need to do is the same concept. You don't want to move that patient until the nurse examine the patient, until the nurse assess the patient. The nurse must assess this person before you move the patient according to instruction from the nurse. Now, the A says help the client into a sitting position, call for assistance from the nurse in charge, offer the client a drink of water, or check for signs of injury. The answer is B, call for assistance from the nurse in charge. You don't want to help that person into any sitting position. You can offer this person water, but at least you allow the nurse to come first and to check for signs of injury. Probably while you are there, you can assist the nurse to check that person's body and see if there is anything. But before the nurse comes, you don't want to do anything. You have to call for assistance and then take instruction from your nurse. Before taking the oral temperature of a client who has just finished a cold drink, the nurse aide should, this is oral temperature. I hope you know where oral temperature, where you need to take it, in the mouth. And now somebody just had a very cold drink. What do you think that will happen when you put that thermometer inside the person's mouth? Because that person's mouth is still cold, the thermometer will not read the accurate temperature. Now, you have to wait at least 10 to 20 minutes before you can take that temperature of that person. I hope you enjoyed this little question and answers. And like I said earlier, this is part of the test-taking skill, trying to walk you through on how to pick the correct answers when you are faced with multiple options. You don't know which one. If you follow these steps, I think you'll be able to pass your exam. This is only when you don't know the right answer though. Then you can, follow these steps of elimination method and picking the correct words, priority words in those questions. Like I said, you need to figure out what are they asking you, the first, the second, most or worst thing that could happen. You need to pay attention to those so that you'll be able to pick the correct answer. I hope you enjoy these little explanations, and if you like what you just listened to now, please like and subscribe. Thank you for watching.